My name is Dr. Shine Ashokan. I'm a sports medicine, orthopedic, and joint replacement surgeon. How much time does it take to recover from a knee replacement? I tell patients that we make progress, or rather steady progress, on a day-to-day basis. Within day one, we are having patients mobilizing at least 2 to 3 times within their room. Day two and day three, they're actually encouraged to move or mobilize out of their rooms and maybe into the corridors of the hospital. Some patients are actually doing their stairs by day three and day four. By week one, a lot of the soft tissue swelling has settled down. Patients are actually becoming more and more comfortable and more confident. By week two, patients' stitches have come out, so the knee mobility is much quicker, or rather stronger muscle function. By week four, between week 4 and week 6, a lot of the soft tissue healing has happened. Patients are not using any walking sticks or frames, and a lot of patients are actually going back to work within that 4 to 6 weeks period. By 3 months, I think most patients are back to level of sports, mild sporting activities, no heavy impact activities, but they're happy to go and do cardio and workouts in the gym. A lot of the times I'm asked, how soon can I go, or rather start driving after a knee replacement. I tell most patients that the soft tissue healing of the knee takes an average between 3 to 4 weeks, and you should be able to do an emergency stop when you're driving a car.